as far as Ben goes, he is your go-to guy. So we'll talk about actions after this training overall, but Ben was really dedicated to support you all in the field with customer presentations, travel, samples, whatever you may need. He is your go-to guy. So the three of us and Remedium are here to support you be successful in this category. Beyond our specific expertise in skin health, what further differentiates us is our speed and agility to customize solutions for your customers. So, like I said, Ben's dedicated to you. Our strategy is to be very deep and strategic with partners instead of spread thin and wide. So definitely reach out to us and tap into our help as we grow this business together. All right, so our agenda for today, we're going to keep it simple for this first training. I anticipate we'll be doing this a lot more frequently as we get into more products and more strategic initiatives. But our agenda for today is we're going to talk about skincare, why it matters in the healthcare space. We'll review Remedium's Skin Centry portfolio of products. We'll talk about some tools and resources to successfully sell Skin Centry into your customers, and have some time for any questions that you all may have. So jumping right in, why does skincare matter in a healthcare space? When you think about medical supplies, most often people think about complex devices, critical care products used in the OR and ER, and commonly forgotten is skin health. Skin health as a category traditionally encompasses a variety of product categories that essentially aid in the prevention and treatment of skin conditions. This can include wound care products like dressings, bathing wipes, mattresses, heel protection, repositioning products, and last but not least, skincare. I bet most of you have your own daily skincare routine that helps keep your skin healthy, help you slow the aging process, or maybe even treat some skin conditions you may have, like dry skin or eczema. And skincare in a healthcare facility is no different. Every patient needs a personalized skincare routine, and that's really where the premise of how we're developing products in our strategy for the portfolio. The main difference in the conditions you may be tackling at home or your goals for your skin at home versus what patients are often faced with in the hospital are those specific conditions. So we're going to talk about some of those specifically. A little warning, some of the pictures are graphic, but I think it's important to know some of the common skin conditions that our healthcare providers and nurses, WOCNs, are faced with in a healthcare setting. So first, incontinence-associated dermatitis, more commonly known as IAD, even more commonly known as diaper rash. So this really is a condition that occurs for anyone who is incontinent, and the urine or fecal matter, there's a prolonged exposure to the skin. So this obviously looks very painful, and the goal is to prevent this from happening. Second photo is intertrigo or ITD. It is another breakdown of skin that happens when there's moisture buildup in skin folds. So warm, moist, dark places, if it's not prevented, if there's not products in those spaces that are preventing the skin from rubbing up against each other or barriers within the skin, these types of conditions or rashes that are very painful can happen in between skin folds. This third image, peri-wound maceration, is the softening and breakdown of skin around a wound based on prolonged exposure to moisture. So as you can see, these three pictures, there's a theme here. Moisture, prolonged exposure to moisture to the skin can cause skin breakdown. In skincare, we would always say if we were doing our job correctly, if all skincare products were utilized as frequently and as often as they should be, then there wouldn't even be a wound care market. We'd be putting that market completely out of business because there'd be no broken down skin. But peri-wound macerations are a result of not properly taking care of the skin around a wound, which, as you can imagine, is really important because if it's not, that wound continues to grow and prevents healing. And then lastly, another common condition we find in healthcare is fungal infections. Again, moisture, those moist, dark places. If the moisture is not being removed from those areas, or the skin is not being prevented from breaking down, fungal infections can occur. Athlete's foot, ringworms, candida are commonly different conditions that happen. But if we're not practicing really good preventative skincare, this is another thing that most healthcare facilities will find.
Allison, let me just can I throw in a comment on that last slide? The second picture, the intertrigo or intertriginous dermatitis, that's actually under the breast. So you can just get an anatomical location of where it is. But to me, that also looks like it might be a type of candida or fungus. So it can be both. And the reason that it looks like the candida versus the fungal that looks more like a ringworm type of fungal is that the second picture has satellite lesions, and that's characteristic of fungal infections. So in the second picture, we're not just dealing with the location, which is the skin fold, but also an overgrowth of fungus in there. So we've got both problems going on.
Thank you, Margaret.
Sure.
All right, so who is responsible in a facility for skin health and the prevention and treatment of skin breakdown? It's the role of a WOCN. So some of you may be familiar with this role. There are a lot of specialized areas in healthcare, as you all know, and skin health is no exception. WOCNs wear a lot of hats within their facilities. Like I said, they're really responsible for providing comprehensive care for patients with wounds, ostomies, incontinence issues. They are responsible for preventing and treating skin conditions. They are often stretched thin in their responsibilities. They may be overseeing an entire hospital or even several hospitals, an entire system. There's definitely not a lot of WOCNs that are covering these responsibilities, and that can directly correlate to consistency in care and stress that they're maybe experiencing. They are key stakeholders for product use and selection. So they often want to evaluate the products themselves or in a department trial to evaluate clinical acceptance. Once they have a product selected, they are responsible for creating the protocol of how products are to be used in a facility. They're responsible to determine who can use those products and then how staff is educated initially and continually on both of those things. As I'm sure you know, there's a lot of staff turnover, so education is a huge challenge for anybody who's in a specialty. WOCN is no exception, to ensure that consistency of care continues to happen through all of their staff and for all patient care. The interesting thing about the skin health space is you will often find that there's no standard protocol that every single facility or system will be using. That WOCNs are, I lovingly say, are very kind of arts and crafters. So they create their own protocols, products, how products are used for patient care specifically, since there are not really strict regimented guidelines. So understanding what that specific WOCN and that specific hospital's protocols for using product is really important. And that starts with knowing who the WOCNs are in your accounts and work to build a relationship with them. They are critical people in this process and to our success of selling the category. So moving on to the skincare market overall, let's talk about some of the dynamics. So the skincare market is about a close to $300 million market. This data, or the $300 million of it, is what I call like the lotions and potions part of skincare. Lots of other categories in skincare might include wipes, hand soap, antiseptic preps, and things that I've listed on the bottom. But that $300 million market is lots of creams, ointments, cleansers, we're going to talk about in a little bit. As you can see here, Medline's remedy portfolio is the dominant leader in this space. In 2020, Medline acquired Convitex, Sensicare, and Alavesta product lines. That portfolio of products is gone. It's been rationalized into the remedy line. In 2024, Medline acquired Coloplast's skincare line. So you may still see those products out in the market, but I would anticipate within about a year, those will also be rationalized into the remedy line as well. So what this really tells us is the market is very ripe for competition. We'll talk about some of the other competitors in a second, but our customers, and the reason why we're doing this is because we just met with a potential customer this week, and they very openly said they want options. They don't like having only one option or one supplier or one product portfolio to be able to build their protocols for patient care. Like I said, WOCNs, they're very creative in how they use products. They're very educated in this space, and they don't like being limited in what their options are overall. From the acute care space, we'll break down the competition and who the main players are. So I mentioned Medline Remedy. They entered this space about 25 years ago, and what they did with skincare was change skincare from a commodity category into a clinical category, and they did a fantastic job doing so. And that allowed other competitors to enter the market or enhance their offering in the market and really distinguish skincare as a clinical category. As I mentioned, Medline acquired Coloplast in 2024, and so I would anticipate seeing those products disappear from the market sometime next year. Smith & Nephew also has a place in the acute care market. They tend to treat skincare as a lost leader to their other categories like wound care. So they have a lot of their sales initiatives, their incentive plans for their sales reps built around selling wound care. And then we'll say, oh, and we have skincare if you want it as a comprehensive portfolio. They don't do much education from the skincare perspective. It's kind of like we have it if you want it, but we're focused on wound care. Johnson & Johnson has a pretty big presence in the acute care space, but their strategy is completely different. They are bringing products into healthcare facilities to turn patients into consumers. So they really want to sample their products, get them in the hands of parents, and then turn those parents into consumers that are going to buy their products from Target, Walmart, Walgreens, whatever it may be, once they leave the hospital. But they've got brand equity and brand loyalty, and a lot of people know Johnson & Johnson must be good for babies. And then lastly, calmeseptine is still a viable competitor in the acute care space. They only have one product. It's a zinc paste with menthol. So it's there to treat diaper rash, or IAD, if you will, with menthol. That's a kind of cooling pain relief effect. So it's one product, just in a lot of different sizes and shapes, tubes, jars, and things like that. From the post-acute care space, same thing, Medline, Remedy, and Coloplast exist. And then the other two dominant players are Dermarite and McKesson. Dermarite, you may or may not have heard, has been looking to have their company in these categories acquired for some time now. But they also very recently had a pretty big and impactful recall on their skincare products and are starting to exit the market. So there is a lot of opportunity for any of your accounts. If you know that they have Dermarite, they are starting to freak out because they know that these products, some of the products have become unavailable already, and they're going to start going away, and they're in need of replacement product. So any of your accounts that have Dermarite are excellent targets right out of the gate. McKesson is unique and similar to Medline in the sense that their primary business is distribution, but they do have their own branded skincare products. They have Thera, which they position as their premium products, and then they have more of a McKesson brand, if you will. But they do not focus on, like, they don't have a skincare group or a skincare team. They really don't focus on actively selling these products. They very rarely even focus on converting products to, the facilities products to their brand. They're very much, if you want it, we have it. McKesson also does not distribute the Medline Remedy line. So anybody that you have who may have McKesson as a distributor is another really great target as well. So all of that information kind of comes back to my point that it is a great opportunity to enter the market for skincare because there's not much competition. It's dominated by Medline. They have a great portfolio, but customers do not like having only one option for this product category. They are looking for choice. They are looking for options, and they do not like to be held hostage to only one supplier. So that's where Centry enters the market. Our vision for this brand is to place skin health at the center of patient care and clinical outcomes, hence the name Centry. We really believe that health is central to skin. Skin is the largest organ in your body, and so if we allow that to break down, it leads to a whole other host of issues, from infections and wounds and whatnot. Our mission, what we strive to do on a daily basis, is to create intelligent skincare systems that protect, repair, and renew skin through science, sustainability, and targeted innovation. So over here, you'll see in this image is an overview of our portfolio. If you're familiar by chance with the Remedy portfolio or with how the market really views skincare, it's color-coded utilization. And when I say that, I mean that bedside caretakers, providers, nursing staff are educated on what product to use when, based on what color that product is. So categories for color-coded utilization, we followed what the market leader did because we want conversion to be to offer clinical outcomes and financial outcomes to our facilities, but we don't want to create more needs for education. So we kept our color coding system exactly the same so they can keep their best practice protocols identical to if they're using the market leading product. So you'll see up here, green for clean is our cleanser product categories. Within those products, they're formulated with gentle surfactants. They're formulated to be dye-free, paraben-free, tear-free, CHG compatible, and hypoallergenic. These are all the things that are really important for each of these categories within this space. Purple is for proper moisturization. Our products are designed to hydrate and protect the skin barrier. Same claims as the cleansers as well. Our blue category is barrier before breakdown. So if you recall that image of IAD or diaper rash, if a barrier had been provided to that patient or applied onto that patient to prevent skin breakdown, it would have provided I refer to it as like bubble wrapping the skin. So if it was exposed to urine or fecal matter, it wouldn't break down. So barriers are really important and come into play for anyone with incontinence to avoid the skin from breaking down. Orange is for open skin. So if that product had, the blue barriers weren't put into place and the skin has open, our orange category is our variety of products with zinc oxide in them. Zinc pastes, or again, commonly known as diaper rash creams. We'll have a traditional zinc paste product, clear zinc ointment product, and zinc with menthol that are all CHG compatible. And the last category within the portfolio is red for rash, which covers those antifungal issues that facilities may be facing. They're formulated with 2% miconazole nitrate, which is the leading ingredient for antifungal products within the healthcare space. and it will come within a powder and a cream product. You'll see the image on the right, we've really specifically and easily labeled our products, our educational call out and how we'll create our guidelines and things like that are all within these kind of call outs on the side. Clear it means we're clearing, or actually this one is cure it. This is an old image, sorry about that. Cure it, which is we're curing the rash, the fungal rash that the skin's affected with. Erase it for orange for open skin. These are the different call outs that we'll build education on. Simple product description, use claims, color-coded category. So it's very, very simple for nursing staff to know what product to use when. As far as our current portfolio and what we have in stock right now, we'll have 2 tiers of product lines. We have Centry Foundations, which is our cost-effective skincare line, and Centry, which is our premium line with advanced formulas. This will allow you to tailor and customize the clinical portfolio based on what each individual customer needs. We have our no rinse cleansers and our shampoo body wash products ready to ship and in stock now. Our moisturizers, we have our lotion in stock. Our premium moisturizers were just completed in production. We should have those in stock in about 2 weeks. Our barrier products we'll have in Q4 of 2025. Our antifungal powder and cream are in stock and ready to ship now. And then those zinc products that fall into the orange for open skin category will be ready early next year. Here's just a high-level image of what we have in stock right now. All right, so outside of individual products, the process of trialing skincare is really critical to the success of getting these into your account. Like I said, the market is really ripe for competition, and you'll have a lot of people say, we're absolutely open to trialing your products, and trials are the primary thing that you want to get. Once you have a conversation with your accounts, you want to work on getting a trial set. So as far as the product evaluation process and support, they really categorize them in these buckets: pre-trial assessment, setting up the trial, in-service and education during the trial, implementation post-conversion, and then how we will help you continue to support your account with training after they've implemented the products. So let's talk about this a little bit. For a pre-trial assessment, what success looks like is really simply these steps. Work with the account to determine the products that they're using and how much of those products that are being used. One of the big things with skincare is we often find that they're not just using one supplier, but they're probably using 4 suppliers and about 25 different products. So there's a really simple opportunity for us to help them consolidate the portfolio of skincare products they're using, which just in turn save them money and increase compliance on products being used. So step 1 is really getting their existing usage so that we can help do an analysis and streamline that portfolio. Then once you get into conversations about implementing the trial, we recommend select about 2 or 3 of their key locations and a handful of departments within those locations for the trial. Make sure you set those goals and kind of write them out and align with your customer on what the goals for the trial are. Usually it's just to ensure that there's clinical acceptance of those products. Agree on what an acceptance rate may look like. Typically for skincare, it's about 75% acceptance rate, which means once those evaluation sheets come in from staff that have trialed the product, 75% of them agree that our products are clinically acceptable and can be converted to our portfolio. Then align on a trial start and end date. Typically a skincare trial only needs to be about a week long. to get good, impactful data. And again, we'll support you on the ground with implementing a good and successful trial. Just a little information, more information about setting up your trial. We have trial announcements that we can co-brand with VMD. We can even co-brand with the individual organization and help them put trial announcement posters out in their supply closets throughout the facility or an email form, so they can ensure that everybody that needs to know that a trial is happening is informed, knows the exact dates, and all expectations are set at least a week or two ahead of the trial starting. Then once the trial gets going, in-servicing and education is critical. We will be there on site to help support both of those things, in-servicing and education to all the staff. We feel this is really important because if there is any concerns or pushbacks, or we can troubleshoot those live during the trial. Oftentimes those things happen, or the feedback comes on a form just from a lack of knowing or lack of having those questions answered and possibly making some assumptions. So we like to be on site all shifts that they allow us to be, so that we can troubleshoot and educate the staff on our portfolio while they're trialing the products. Then, assuming all of that goes well and we've agreed to convert to the Centry line, we will additionally help support on-site with that conversion, whether it's moving inventory of the existing portfolio out of supply closets and our product in, or whatever that may look like based on the individual facility's needs. We'll be there on site to make sure that happens. And then we'll additionally help you provide post-conversion progress reports. So like I said, we want to ensure that if they were using 6 different skincare suppliers and 25 different SKUs, that 3 months after we implement Centry, they're not the products, they're not at 2 suppliers, and other products are finding their way back in the door, but that they've got compliance across our portfolio. And if not, we help them get back to that. And then ongoing training and support, a little off of what I was just saying. On a quarterly basis, we'll help you provide a regular cadence of usage analysis. Like I said, making sure that there's only one supplier and the products that they've selected continuously being used within the facility. Additional tools and check-ins with the WOCN or nurse champions on ongoing staff education to make sure that any new staff entering the building, it's very clear and easy for them to know what products to use when, from the skincare protocol perspective. Any new product introduction and training, so as we add products to the portfolio, that the account is trained on those as well. And again, any on-site support that you may need, Ben is your guy. As far as sales tools and resources, we have and are creating a lot for you to support all of the presentations and trials and all the things that you need to be successful. We've created a quote worksheet for VA accounts specifically. Right now on the FSS contract is our antifungal powder and foam cleanser, and we're working to get additional products added to that contract. But we've got a quote worksheet for the VA and one created for your commercial business. So the additional accounts that you have outside of the VA, you'll be able to quote the entire portfolio of products. We have cross-references available, sell sheets available, as well as skincare guidelines that will all be supportive to you. And then lastly, so after we've gone through all of this, what are your next steps? So we would like you to find and think about what your top 3 opportunities are. Which accounts? Maybe you've been in an account and you saw that they were using a Dermarite product. And they would be a great opportunity because now you know that they are probably having supply chain issues and don't know what they're going to do for skincare. That would be a great opportunity for you. Once you've identified those top 3 opportunities, send them to Ben Primer and set up a strategy call, going over what the account is using and what your next steps may be. Book travel with Ben and present skincare to the account. And your goals for each opportunity should be, number one, everything I say really starts with usage. Once you get that skincare usage, we'll analyze it and consolidate that into a meaningful portfolio for your customer. We'll present the category and samples, and then we'll help you get a trial date established and confirmed. So those are the three things that we would like you to do leaving this call. And now I will open it up to any questions you may have.
So team, a couple of other things. Keep in mind that the products from Medline, the Remedy line, the Phytoplex line are on MSPB contract. So what we're trying to do is put our toe in the door with products that are not necessarily on FSS, but once we have a couple of customers purchasing, they can make that request to have them added. So we need to reach out to your friends and family program, get them the samples in their hand, and ask if they wouldn't mind trialing them out in their department, just because Medline has had such a chokehold over this market for so long. On the commercial side, we're already seeing some of you take these to your wound clinics. So we have a rep that had a patient with a couple of wounds that were presenting a fungal infection. And as they mentioned in the beginning of the call, the skin nutrition is of high most importance for the prevention of breakdown in these wounds. So there's several products in the line that even your wound clinics would be able to take on. And then as you're going to even medical suppliers and you're showing, let's say, the toilet assist device or the foot defender boots, look on the shelves and you'll see Remedy products there. You'll see Smith and Nephew. Take a picture of what's there and ask Ben for a cross, and you can offer a cost savings with a similar color structure with what we think is equal or superior product for them to carry in those medical surgical supply areas. Anybody have any questions for this team?
I know this is a lot for a Friday afternoon, so if you think of anything over the weekend and it comes to you Monday, please reach out.
Next time you have to Uber Eats their like glass of wine or kick off the Friday call.
Yeah, or an energy
happy hour.
Energy drink and a glass of wine.
But you can't start drinking until after the presentation, right?
Yeah, just to solidify that retention.
Yeah.
I know Gary, who's on the call, has already presented it to one of the VAs that he was in, and they're open to having conversations. And Ben, I think you and Gary worked together a little bit already. I strongly encourage you guys to reach out to Ben with some of your key connections so that he can put together a little package for you for getting the cold call started or that introduction started. He's available to travel. He's available for virtual meetings. Just use that resource to strategize your territory so that you're not alone out there.
And can you guys publish your email addresses again? And how do you get samples?
So I provided Allison with an email address spreadsheet and a mailing list.
Yeah, let me go back, and I'll go back to, this is our information. We're going to send out, Ben will follow up with you guys and send this presentation out, but if you want to take a snapshot of our email addresses, they're right up here. Please reach out. If you have any customers where the presentation is going to be heavily clinical to WOCNs or any clinical stakeholders, make sure that you've got Margaret looped in that as well. She provides a lot of credibility and a ton of knowledge and experience in this space and is a great resource to speak to very clinical individuals.
All right. Well, I'm sure if there's questions, just like with the last call, they'll be hitting me up for advice and samples soon after. So thank you again for participating on a Friday. Thanks to the Remedium team for this presentation and the samples. If you didn't receive a sample and you have some opportunities to present, just shoot me an email and we'll get some out to you. Thanks, everyone.
Yes, thank you all.
Thank you.
Thanks everyone.
All right.
Appreciate it.